The sad fact of the matter is guys have a lot working against them as regards their testosterone level. First of all, just the aging process. There's one testosterone producing cell in your testicles that dies, goes offline, never comes back every 4 seconds. And this goes on from the time you're, a boy. So that starts to accumulate, of course. And then over time as well, you have, accumulation to toxic pesticides like BPA and endocrine disruptors. And by the late 30s, it's an opportune time to start to look into it.
What if the next phase of health wasn't about more medication, but about unlocking the body's ability to heal, thrive, and perform at its peak? Today's guest, Dr. Michael Turner, is here to show us how. Dr. Turner is a board-certified physical medicine and rehabilitation specialist with more than a decade of clinical experience. As a graduate of Stanford University, Harvard Medical School, and Mayo Clinic, Dr. Turner has built a practice focused on high-performance wellness, regenerative therapies, and advanced longevity strategies. Whether he's helping professional athletes recover faster or guiding everyday patients through hormone optimization and metabolic repair, his approach is rooted in science, compassion, and results. In today's episode, we'll dive into the science and strategy behind peak performance medicine, exploring how nutrition, movement, mindset, and personalized protocols can help your patients not just survive, but thrive. Dr. Turner, thank you so much for being here.
Lovely. Glad to be here. This is going to be quite fun. Thank you for having me.
Of course.
Yeah. Thanks for coming on, Dr. Turner. I wanted to start out a little bit about your personal journey into this space of medicine. So what inspired you to go from conventional training into a more functional and regenerative space?
Really, it was just an outgrowth of who I am as an individual. It was just sort of an evolution and expression of what's important to me. So I grew up with very health conscious in California. I had a mom who used to be a hippie and used to work in a natural food store. So I grew up like no sugar cereals, minimal screen time. They never bought me a video game system. I was around when Nintendos first came out. Like I whined, I complained, I threw tantrums. My mom refused to buy me a Nintendo. We had dinner every night at the table. She read books to me at bedtime, that kind of thing. So I had a lot of healthy, wholesome health behaviors. And I was always interested in being as healthy as I could possibly be. And I remember when I was a teenager in particular, I started to take ownership over my health. Like I took a health class at school and I got kind of inspired. And then I realized I was eating candy bars and soda and all this junk. And so I started running and lifting weights and just trying to be the healthiest, best me. And I essentially never stopped. So being a healthy me became before my dream of being a doctor. I didn't actually start college wanting to be a doctor. So it came a little bit later. And it was natural then for me to just ingratiate that into my existing drive to be healthy. I mean, who doesn't want to be healthy, right? But I'm kind of an overachiever and a nerd on some stuff. And I just kind of kept going with that. And so I structured my medical practice around that, prevention, wellness, coaching, health, longevity, all the good things.
I love that. You're so energized and vibrant. And it's so cool to kind of hear that story because I feel like it's so common in our space for practitioners to get to the functional or holistic side of medicine from like a health crisis. So the fact that you've just, this has kind of been instilled in you from a young age is really awesome. I do want to jump into kind of right off the bat here, getting into hormone health. It's really common that we get to speak to women's hormones, but I want to get a little bit into men's hormonal health. So what is your approach for assessing and optimizing hormone levels in men?
Absolutely. Well, the first thing I do is talk about their symptoms. You have to have a full understanding of their symptoms first before you jump into lab tests, or else it's hard to make a correlation, right? Just to give you an example, sometimes men will have terrible symptoms that you think are testosterone deficient. And when you check the lab, it's really not that. And if you have blinders on, then you're not knowing where to go at that point, right? But if you realize, well, wait, their symptoms could be from their thyroid, or their vitamin D deficiency, or their MTHFR problem, or a bunch of other things, then you're kind of like, staying agile. So I first ask them about their symptoms, and I come up with what we would call differential diagnosis, but in my mind, a bunch of reasons why they might be having their symptoms. And then we'll go check on testosterone. And if it is or is not seemingly the culprit, we still have a good plan in place. So the typical symptoms that might lead one towards testosterone deficiency would be a guy who talks about lack of energy. He'll say, I come home from work and I just want to sit on the couch. I don't have energy to do projects. I don't have energy to go to the gym. I'm tired in the afternoons. I'm taking caffeine at work. I don't feel like working out. If I do work out, I don't feel strong. I'm not making gains. I can't finish the same workouts I used to do 5 years ago, something like that. So there's an energy component to it. There is a sex drive component to it. So libido drops off, erectile function drops off. There's a mood component to it too. Guys will talk about feeling a little more listless, blasé, flat, versus, let's say, energized or wanting to take initiative or drive, would probably be a great word for that. So those are some of the typical ones. And then there's, sometimes, of course, body changes. It's hard to differentiate that from aging sometimes, but basically we know testosterone promotes muscle mass and promotes fat loss. So the opposite of that can absolutely be a sign of possibly low T.
Super helpful to set the stage here, Dr. Turner. And around what age should men start considering hormonal changes such as these? I mean, we're thinking, just throwing it out there. I mean, as early as 30s, maybe. I just heard a provider talk about testosterone dropping in the 30s.
That's a fair statement. I would say late 30s. I would say, let's just say 35 or more. A guy should absolutely get his level checked and start to pay some attention to that. Yeah. So the sad fact of the matter is guys have a lot working against them as regards their testosterone level. First of all, just the aging process, which women also have to deal with, right? But the aging process of the testicles, there's one testosterone producing cell in your testicles that dies, goes offline, never comes back every 4 seconds.
Oh,
Okay, that's the stat. Yes. And this goes on from the time you're, a boy. It doesn't matter. The aging process rolls on. You lose one testosterone producing cell every 4 seconds. So that starts to accumulate, of course. And then over time as well, you have, accumulation to toxic pesticides like BPA and endocrine disruptors and other such things. Not to mention your stress and your lifestyle that might not be conducive to our hormonal health. And so by the late 30s, it's an opportune time to start to look into it.
Mm. And let's talk about andropause.
Yes.
What is andropause?
Yeah, well, I like the word because it helps us frame, the concept of male health as opposed to menopause, right? So we all know about menopause, the ovaries stop working so much, hormone levels drop. What about andropause? It hasn't really been defined and discussed so much. So I'm glad that it's coming more to the front. But essentially, would be considered that stage in life where you are not producing enough testosterone to keep your body in a healthy state. And you start to exhibit some of the symptoms that I mentioned earlier.
Right. And I want to talk about labs. And you mentioned briefly vitamin D and thyroid, in addition to testosterone, of course. And I want to get into how you screen for high cholesterol. Of course, we need to think about advanced lipids. A standard panel is not going to be enough. I see that you mentioned that on your site.
Yes.
And I love how you have an FAQ kind of set up on your website, that kind of is a little bit of myth busting, some surprising stats thrown in there. I just love that. And you mentioned that total cholesterol is not enough, of course. So I want to get into that. But before we do, let's just start on hormones. Are you starting with serum? Are you also using saliva, urine? Can you talk to us about comparing the specimen types for hormone testing?
Yeah, to a degree I can. I'm no big lab expert on different testing and the nuances of it. So I stick with serum tests for the most part. Yeah. So I would stick with, for a guy, I would want to know, of course, his total, his free testosterone, probably his DHT. There's also sort of a niche lab that I like called androstenediol glucuronide, kind of a big mouthful, but I learned that at an A4M conference from Dr. Henri, who's a Belgian endocrinologist, sort of uber famous, talks, does a lot of CME and stuff. So I like to check that. I still want to check, of course, on a guy, their estradiol level, very important. Even their progesterone level. Progesterone has a role in men. Most people don't quite realize that. It has a big role in erectile dysfunction, for example.
Okay.
Yep. And then their DHEA level, quite importantly. So that would be just purely on the testosterone and sex hormone side. Ultimately, I will end up checking their thyroid and checking their vitamin D. We don't always do that at once because it's a lot to pull off. It's, you don't want to overwhelm the patient with data and too many trails to go down. But that would be the essence of an evaluation.
And testing testosterone in the morning, is that your go-to?
Yeah, testosterone levels typically peak first thing in the morning. And so we like to test them, let's say 8 to 10 a.m.
Mm-hmm. Okay. So let's talk lipids.
Sure.
We would be remiss if we didn't mention cardiovascular disease and the huge risk there for everybody. So what is on your screening lipid panel?
Yeah, so my screening lipid panel would typically be about 7 or 8 things. So You can do an NMR lipoprotein profile. I quite like that. I either do that or a simple fasting lipids with an apolipoprotein B sort of appended to it. So that's sort of step one. Then you've got fasting insulin, you've got high sensitivity CRP, you've got homocysteine. I check LP little a, which is a genetic marker towards cardiovascular risk. You may know about that. I check omega-3 versus 6 fatty acid ratios, and sometimes like a fibrinogen.
Okay. Yeah. Quite comprehensive there. I like that. What about micronutrients? Just while we're on the topic, because I know we're going to get into sports medicine and hormones, and I'm curious if you mentioned vitamin D, but are you looking beyond that? I mean, doing a micronutrient panel, maybe you mentioned that as far as athletes on your site, that's important.
Yeah, micronutrient deficiency is a big deal. I'm a big fan of several different tests I've used. I know Vibrant has one or has recently come out with one, so I'm quite intrigued about that. That would typically be for more of a high performing client. It's not everyone, to justify the cost and the amount of information that's going to come
Sure.
back, but it can be quite revealing. You're going to see, low levels of antioxidants or selenium or certain B vitamins or magnesium. And so it's usually my sort of guys who would be deep into CrossFit or triathletes or something like that, and they just want to optimize their performance. We check that micronutrient screen. But on the sake of more just a regular Joe guy, micronutrients are important for thyroid function, for example. Your thyroid has to have a certain amount of micronutrients to create adequate hormone, right?
Right.
So we want that to be there. Your bone marrow has to have a certain amount of micronutrients to create antibodies, white blood cells, red blood cells, and all of that. So it's fairly important.
Yeah.
Are there any supplements that you're kind of finding yourself recommending across the board for most patients?
Oh, yes, absolutely. Absolutely. I would say across the board for everyone is fish oil, aka omega-3 fatty acids. It doesn't have to be fish oil, but I'm such a fan of it. It reduces inflammation in the body, which does every good thing that inflammation, would tend to promote. It counteracts that, including cardiovascular disease. Inflammation is tied to cardiovascular disease. It's tied to cancer. It's tied to dementia. And omega-3 fatty acids can cross into the brain. So now we have that brain promoting and brain protecting effect of them. They're also strong antioxidants. Omega-3 fatty acids, fish oil, have a strong antioxidant function as well. Helps with like NRF2 and glutathione and some other strong antioxidant pathways in the body. I love it because it's good for the brain. Also, it boosts BDNF levels. Um, it it has a role in energy creation in the mitochondria of your cells. The omega-3 fatty acids do. And they have a strong anti-cancer role as well. So for all those reasons, not to mention they're readily available, inexpensive, and extremely safe, I think every human being should be on omega-3s, usually 2 to 4,000 a day, depends on, how many problems we're trying to solve. That's a top supplement for everyone. I'd say another top supplement for everyone is vitamin D. Vitamin D is actually a hormone I could talk about a lot. I actually did a research project on it when I was at the Mayo Clinic. So it's kind of a pet topic, but it's basically a hormone. It got misnamed as a vitamin when it got discovered. People should understand that it's a steroid hormone, goes in your cells, does things just like progesterone or testosterone or any other steroid hormone. It just happens to be a hormone that we need sunlight to catalyze, which makes it a little different, right? We're just dependent in some sense on something from the outside in order to get that hormone fully activated and present in our bodies. But, vitamin D, amazing role. We knew initially that it had a role in musculoskeletal health, like bone density and rickets, right? But turns out actually muscle density, type 1 muscle fiber density, strength is improved when vitamin D level goes up. Huge role in the immune system to support someone who's critically ill, huge role to prevent autoimmune problems like multiple sclerosis. The neurologists have known about vitamin D levels in multiple sclerosis for a long time. That's a big deal. And, even mood. And so for all those reasons, vitamin D is probably a heavy hitter. I'd say everyone should be on. And then I would say the last thing to round that out would be like a nice superfood powder, let's say, right? Some superfood powder you just put in your NutriBullet, you drink it down, you don't have to think about it. It's like the equivalent of 10 amazing salads, right? And so even if you're having a busy day, you don't like to eat a lot of salad or whatnot, it's like you covered all your superfoods. It's got every healthy thing known to mankind in there, right? It's got broccoli and spirulina and chlorella and like tart cherry and all the things. So there's a brand that I like off Amazon, and I try to get everyone to start making a habit of having a smoothie in the morning with a scoop of superfood powder. Those would be my top 3.
I have to know what that is if you're comfortable sharing it.
Yeah, I'd be happy to. So Orgain, 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 they have a superfood powder that's amazing. It's got like the top 50 dehydrated superfoods. It's got probiotics. It's really solid. Yeah. And
10
it's
super salads in a powder. That sounds great.
yeah, right. I'm a big fan of salads, but sometimes you're busy and whatnot. You
Absolutely.
don't have all the ingredients you'd like to have and stuff. Superfood powder just solves those problems. Very
That's
convenient.
a good point. Yeah. What about vitamin D daily dose for maintenance once you get it to an optimal level?
Yeah, so the typical vitamin D daily maintenance dose is going to be about 4,000 to 6,000 units. That's going to be maintenance. Mm-hmm.
I feel like a lot of providers speak to maybe like 2,000, but now I'm seeing higher, for maintenance, like 5,000, I think is a sweet spot. So I agree with you there.
Yeah.
I mean, it's so important to just keep eyes on that level too, to get a baseline. You have on your site, Dr. Turner, and maybe it was, I'm not sure if it's the Orgain. I would doubt it. You have, $2 a month. You have what supplement? Okay, so this is different. What supplement? And this is per your website. What supplement boosts testosterone levels, boosts energy, improves sex drive, treats depression, lowers anxiety, lowers blood sugar, boosts immune function, and protects against Alzheimer's? And available via high quality supplier on Amazon for only $2 a month. Can you
Isn't
tell
that amazing?
us?
Yes, I will tell you. Those are all research backed, by the way. I just took references right out of literature and just dropped the benefit in there. So that's all like very, very solid. That is DHEA. That's DHEA. Most people don't know, typically about DHEA. I always check it. I'm a big fan of repleting it in men and women. All those things are proven from keeping DHEA levels up. And it's very readily available, inexpensive.
Okay. Yeah. And you feel like it's safe. I feel like, because it's a hormone. So we were talking to a UK provider and she said it's prescription only, she's compounding it into, her other HRT, but this is over the counter.
It is. Oddly enough, it is a biologically active hormone. It was available only by prescription, even in the US for a long time. It became over the counter, as I recall, sometime in the 90s or something, where they basically shoehorned it in as a food and dietary supplement because they figured out how to take some yam that they sourced from Mexico, if I have the story right. And they did some chemistry on this yam and they could create DHEA. So they sort of said, well, this is really a food, item and it's not strictly a medical thing. So, because of that, it kind of hit the market. That's not necessarily bad. I mean, I think, on balance, it's fairly harmless, but one should have one's levels checked. Absolutely. So I check levels. I like to push it a little bit. So the typical reference on the lab, by the way, for a guy, I'll say like 100 to 300 or something like that, maybe 350. Scientifically defined DHEA optimization for guys more like 400 or 500. So I tell them to get comfortable, even if the lab flags it as high. Let's push that up there a little bit. It's so inexpensive and readily available. It's phenomenal. Women, I like to keep it maybe 200 or 250.
You're speaking to a therapeutic dose range as far as checking that levels on DHEA.
Yes, those would be the blood levels. Yeah, DHEAS. And to your point about vitamin D, it's really important to check those levels as well. I'm sure you've seen this, Dr. Brown, that patients will come in and there's two things that can go wrong. They'll tell you, I'm taking 10,000 units a day, and you're like, wow, that's kind of a stiff dose, and you check and then they're too high.
Yeah,
they're
totally.
like 120 or something like that, kind of like, whoa, overshot that. Or they'll tell you, I'm taking, I'm fine. I don't need to check a level. I'm taking 6, 7, maybe even 10. And then they're too low though, still somehow, right? And that's because there are other factors involved. There's genetics of vitamin D. There's also magnesium levels play a big role. If you don't have enough magnesium, it's hard to get your serum vitamin D level up. You can keep giving people vitamin D. You can't get that level up. So it behooves us to always really tie it into a blood level. And the way I explain it to patients, it's like filling your tank and topping it off. So filling your gas tank, we got to be aggressive. We might need you on 50,000 once or twice a week, right? Topping it off, not so much, right? Once we get your levels to 60, 70, 80 where we want it, then you maintenance on 4,000 to 5,000, maybe 6, something like that.
Yeah, I like that analogy. That's great. All right. And so I want to jump into sports medicine a bit. And then this ties into hormonal health. Of course, I'm sure you're seeing men and women who are athletes and they want to focus on hormone optimization, right? So it's all related. Were you an athlete growing up? Are you still an athlete? And I want to talk about kind of your experience and what sports you like, because I think it's fun.
That's kind. Thank you. Well, I did grow up athletically. So I played baseball, I played soccer, I played basketball through 8th grade, pretty active with that, enjoyed it. In high school, I made a bit of a turn actually towards band and drama.
Oh,
So
you're
I was
very
a
well
band
rounded.
nerd. Yes, I played trumpet and marching band and jazz band.
Very cool.
I know. And I was in a couple productions like Grease, a couple classical high school musical type stuff. I really enjoyed that. I just kind of kept up on my side with more fitness at that point. So I wasn't on a team sport, but I was running a lot, lifting weights, as I said, playing basketball with buddies. And as I've gone on, I've bounced around, but I've always maintained a fitness focus. So at times, a big emphasis on hot yoga. At times, like kettlebell functional training. Right now, I'm really into swimming. I'm really into open water swimming. Actually, it's just tremendous. So I like to get out,
Oh.
rivers, lakes, ocean,
And you're up in
swim.
Washington State,
I'm a
so you putting on a wetsuit? It's really cold.
Often,
Or
yeah,
no?
it's
you
wetsuit
you like your
territory.
cold
Yeah,
plunge.
often. That's the one. That's the one drawback to open water swimming. You got to get comfortable being in pretty cold water. It's always a little bit of a shock at first. It's always very uncomfortable at first. You got to just push through. I guess that's like cold therapy in a way.
Yes. What's the
Um,
temperature right now, would you say?
Water temp.
Wherever you're jumping in, yeah.
Yeah, I mean, I've been swimming indoors at a pool lately, but it's probably high 50s.
Yeah.
Which is going to be real chilly. Water starts to feel chilly once it's in the 60s. You're like, oh, this is a little cold. And if it heads down to low 60s or 50s, you're like, teeth or want to start chattering. So, yeah.
Well,
Yeah.
speaking of cold therapy, I want to get into different therapies that you like or use in your practice. But let's start by just defining, what are regenerative therapies and how are they working?
Yeah. So there are different qualities of regenerative therapies. I would put them in a few categories. So I would talk about injections. There are regenerative injections that can be done. This would be prolotherapy, PRP, stem cells, or even prolozone, which is applying ozone through an injection. We can come back and talk about any of these categories. I put in another category mentally, I would say modalities. So we've got regenerative modalities, right? This would be your red light, your PEMF mats, perhaps hyperbaric oxygen, right? And then we have peptides, of course. Some of my favorite from a regenerative viewpoint would be MK677 or BPC157 or TB500. And then I would even say certain supplements can be regenerative, right? And so I would say things like hyaluronic acid, glucosamine, chondroitin, collagen. They all help renew soft tissue in the body. Let's use the example of arthritis, right? What's cartilage made out of? And can you renew cartilage in the body if you give it the right supplements and right substrate? You can. And then there are certain supplements that help kill off senescent cells. And so you could say that that's also rejuvenating, right? So that's like your quercetin or your fisetin to try to, trim back on cellular senescence.
There's so much you inject in, there's injections, like you said, IV therapy, oral therapies.
Yes.
But I do want to focus on the joint regenerative therapies. We haven't talked about those on this program before. So there's prolotherapy. And so my understanding is this is kind of the entry level, and then maybe we want PRP, and then there's stem cells, right?
Yes.
So can you walk us through what is prolotherapy and take us through the more advanced therapies?
Yeah, I'd be happy to. This is a great concept. So the way I describe regenerative injections, I counterpose them with cortisone injections, first of all, with my patients to help them understand. Cortisol injections do have a role. I'm not demonizing them. They can reduce pain. They can reduce inflammation. They can, help tide someone over while they rehab in physical therapy. But what cortisone does not do is it doesn't heal or strengthen anything. And there's tends to be a limit in how many you can give a person. And they tend to not work as well over time. Contrast that then with regenerative injections, which actually heal and strengthen tissue. The image I use for patients is welding. I said, let's say you had a rotator cuff tear and we went in there and we want to just do some spot welding on your rotator cuff. Okay, that's what a regenerative injection is. It stimulates actual healing. Number two, what's great is it doesn't wear off. People ask, well, how long does a prolotherapy or PRP last? It's like, it doesn't. It doesn't wear off. It stimulates a burst of healing, and that's just your new set point. You're hanging out there. It doesn't have
I
like
love
a half-life that it wears off, right? So we love that. You can also do them in pretty much any age range. You can do Prolo safely on children all the way up to people in nursing homes. Okay. Because again, it's not hormonally based. It's not like giving someone cortisone, right? So it's safe at absolutely any age. And so I love it. It's pretty readily available. affordable and such. There's sort of an escalation. Prolotherapy is down here. Traditional prolotherapy has glucose in it. It's simple. It's 2 ingredients, glucose and numbing medicine, aka lidocaine. Turns out that glucose at the right concentration is a powerful stimulus for growth and healing in the musculoskeletal system. Glucose at the right concentration is part of your own natural healing response. If you got a cut, the local glucose concentration would rise to a certain level, and that triggers off a bunch of molecular signals towards healing. One thing that the right concentration of glucose does is it attracts your own platelets and it attracts your own stem cells to that area. So it's sort of like dominoes. The first domino to fall is the glucose levels a certain way. Then the platelets get activated. Then the stem cells get attracted, and it kind of escalates and gets bigger as we go like that. So you can intervene at any of those levels. You can intervene in prolo. You can start with a PRP. You could start with a stem cell, although I don't recommend that. That's typically overkill, right? So usually patients will come and they'll say, I heard about these stem cells. My knee's been bothering me so bad. The doctor says I might need surgery on. I don't want to do anything. Should I get these stem cells? And I'm like, well, maybe that's not a bad idea per se, but it's probably overkill right now. Like, we should get you on your glucosamine, your chondroitin, your fish oil, your hyaluronic acid, right? And we should show you a couple stabilization exercises for your knee. And we should start with probably some prolotherapy or PRP, and I bet we'll solve your problem. So I'd say 80% of things will get solved short of needing a stem cell injection. But yeah, that's the idea of it.
And I'm glad you speak to that, because so many sports medicine docs and providers are skipping prolo altogether. And I think maybe they'll start with PRP and then they offer stem cells. But it sounds like you maintain that prolotherapy really does still have great utility in so many of these cases.
Oh yeah, absolutely. It's a great beginning point. I would say you if you had some run of the mill musculoskeletal problems, you're going to be able to take care of them 70% of them with just prolotherapy alone, and it's less expensive. Like the typical prolotherapy injection might be $300 to $400, $500, something like that. PRP will be about double that, maybe $800 to $1,200, and then stem cells is like whatever, tens of thousands. I mean, sometimes. So for the value for the patient, it's great, and it's very accessible, including to naturopaths, right? Because it's not a synthetic substance. So I'm the hugest fan of prolotherapy. You can solve, lateral epicondylitis, medial epicondylitis, rotator cuff problems, whiplash, cervical ligamentous strain, sacroiliac ligament strain, ankle sprains all day long, knee, intra-articular knee stuff for arthritis, or extra-articular knee things like MCL sprain or IT band syndrome. I mean, if there's a sore spot on a person's body musculoskeletally, you can hit it with some prolo and get it strong, including TMJ. They've done that.
Okay.
So, yeah.
Which can be so stubborn for so many people.
Yeah.
So, okay. And then, so when would you then say, let's bump it up to PRP?
Yeah, I would say if they haven't responded great to the prolo. So the way I describe to patients, I say, we're going to kick off a wave of healing. It's going to peak in about 30 days. So I want you to come back and I'm going to ask you, what percentage better do you feel? Right? If the people come back and say, I'm not sure if it helped, or I feel 10% better, that's not good enough. And I'll say, we got to escalate to PRP. But that tends to be on the minority of cases. Yeah.
I was going to ask, how do you determine which patients are like good candidates? But it sounds like you kind of have this like screening system or way of going about it.
Yeah, well, I would want to know, where is their injury, first of all, and I would want to know how severe it is. So, and what's been tried, of course, before to help, right? And so you put all that together in kind of your algorithm. Most people can start with prolotherapy and do quite well. If someone has really, really severe case and they want to be very aggressive and get, better quickly, let's say, I might send them right off for PRP.
So next question, Dr. Turner, and I think this is a great question if I can say so myself. But, I want to know, how can patients get the most out of prolo and PRP? Any tips for prepping or post-procedure?
Yeah, I would say a couple things. The first one is PRP and prolo need you to actively be exercising that body part. We need that, right? It's not contraindicated. In fact, it's encouraged. In fact, it's necessary. Right. And I tell people, we're trying to get new healing of tissue. Let's use the example of your ankle. We do an injection there. We're going to stimulate collagen deposition, but the collagen needs to line up in an organized way. This is a key principle of rehab and sports medicine. For example, think of just injuring an ankle and you don't really rehab it. Okay. If you don't rehab it, you get what we call disorganized collagen deposition. So the ankle slowly kind of heals, but it's like spackle, it just sort of throws down some spackle here and there, but it's kind of disorganized. So there's some scar tissue and some spackle, and it's just sort of kind of tight, but it's not really dialed in, right? And then you re-injure your ankle easily. Whereas if you do active rehabilitation, when you're rehabilitating, when you're putting shear stress through the ankle and putting it through certain movements, you're showing your body where you want the collagen deposited, aka deposited under lines of stress. And that is physiologic and helpful and strong, right? So we are supercharging collagen deposition through these regenerative injections. We therefore want all the new tissue that we're forming to line up under lines of stress, which means you got to show your body where the stress needs to be so it can come repair in the right place and not just be indiscriminate thrown out cells. So hugely important. So I do a personalized, off the shelf rehab program with everyone relative to whatever their problem is, if it's a shoulder, knee, et cetera. Or if they can't come to see me further, get them into solid physical therapy. So that's one thing. But the second thing would be keeping their nutrition up, so like your adequate protein, your adequate collagen. And even if you want to go to a bit of an advanced level, there is the idea of oral stem cell releasers. So there's a company called Stem Regen that I came across not too long ago, and they have a variety of products that are natural, like blue-green algae and something called sea buckthorn, a bunch of different plant extracts. But they've been researched to actually cause release of stem cells in the body. So people who want to really be aggressive, I get them on the Stem Regen product to release some of their own stem cells from bone marrow to just augment everything that's going on.
Very cool. It's definitely a holistic approach I see that you're doing here. I appreciate that. And you mentioned physical therapy, but it sounds like if patients can come see you, are you walking them through some of these exercises? I mean, I feel like, and you said very personalized, because PT can be so, what is the word I'm looking for? I mean, universal, typical, one size fits all, if you will.
Yeah.
It's so hard to find a good physical therapist. Am I correct in saying that? That's been my experience, at least.
I think you're right. You're not off to say that. It can be pretty hard. Sometimes physical
it's so
therapists,
important too.
It is. It's really important. Yeah. Sometimes the patient feels like I'm not getting much attention, or they handed me the aid and the aid just like put a hot pack on it and
They
talk
leave
to
them in
me.
the corner.
Yeah, getting left in the corner with a hot pack or something. So I like to take some time to outline a program for them. And there's an art to it, right? There's an art to it. Like if you come in and you say, hey, I have a partial tear in one of my rotator cuff tendons. Okay. But you are a former college athlete and you're 26 years old and you do CrossFit. Okay. Or if you are a 70-year-old woman coming in a walker who fell at the nursing home, my rehab for you obviously is going to be very, very different, right? Because there's what you can tolerate, what you're willing to do, how much discomfort you're willing to put yourself through, like how aggressive you want to be to get better quickly, all of these things. So those are all personal factors. So there really is no one size fits all. I'm in my mind have this menu of exercises, but you don't want to overreach and ask the patient to do too much, or they're not obviously going to be able to move forward. And you don't want them to ask them to do too little, or they will not move forward quickly as they would want either, right? So you have to strike that right balance. That's the art of it. You got to know your patient.
Right. What about credentials? I mean, of course, physical therapists. I had a personal trainer recommend finding a personal trainer who has a real rehabilitative background instead of a physical therapist. I liked that tip. Are there any kind of maybe, and there's so many different certifications when it comes to personal training, or, I mean, do you have any thoughts on that?
Well, I would say that physical therapists and athletic trainers exist in different realms, and each one has a role. Okay, physical therapists are coming to fix problems. There's basically been a problem, there's a breakdown, and they got to solve it. The athletic trainers are over here trying to optimize your function, working with perfectly healthy people on sports teams and trying to get them even better, let's say. And you got to kind of know your role. So the athletic trainers, sometimes they start to err if they're trying to diagnose and treat injuries, which is not their forte. That needs to be, the sports medicine physician or the PT. PT sometimes aren't the best at outlining a proactive program for somebody who's healthy and high functioning necessarily. The athletic training certification that I'm most a fan of would be CS, Clinical Strength and Conditioning Specialist, CSCS. That's sort of the highest level of this athletic training realm over here. And then physical therapists, they've come up with doctorate degrees lately. I don't know if that's all necessary, to be honest. I don't have, a strong opinion on that. I wonder if it's just a little bit of over escalation of academia. But there's that.
So many different providers and disciplines now. It's good to have that conversation because I think it can be confusing, particularly for patients. I mean, I know it is confusing. If it's confusing for us healthcare providers to keep up with all the degrees and training programs and certificates, it's a lot. Okay, Dr. Turner, we're coming up on our time here, but there's so much good information, and I'd love it if you could share a case, maybe one of your favorite cases. You mentioned, treating people of all ages with Prolo. And maybe it doesn't involve prolotherapy, but is there a favorite case as of late that you can share with us?
Sure. Yeah. Let me think through that. Would be a best.
Maybe it combines hormones and sports medicine. I just want it all wrapped up in one.
There we go. Yeah.
If possible.
Yeah. So I'll give you a good case. So I've through word of mouth, I've started to have a lot of police officers in my area come find me. And these are guys who obviously need to be high performing at their job, but it's also difficult. They have shift work, right?
Yeah.
So their sleep schedule's off. They're under a lot of stress. And they're getting into their 30s and 40s and 50s just like any other guy would, right? So it's very compounded for them, the types of health problems and types of hormonal problems they might have, right? So once I fixed up solidly like one of these PD guys, he was all of a sudden recommending like word of mouth travels. So I started getting all these guys. So I remember one guy, he was probably late 30s, had a wife, couple kids, and he was having such bad shoulder pain, he couldn't lift his gun. Okay, he's like, I have to go qualify and I have to go to the shooting range and lift my gun. He's like, I've been reassigned to Destiny for a while. I literally cannot lift my gun and shoot this thing right now. And I've done PT a bunch of times. I had this MRI. I was told I might need surgery. I really don't want that. So he was pretty hard up, as you can imagine. Separately, he had low T, metabolic dysfunction, obesity, lack of drive, tired, all of that. So we sort him out on the hormonal side. I got him going on some basic lifestyle concepts about, eating and sleeping and, consistent exercise and cardio and things, checked his lipids. But then over here, we basically just did 2 rounds of prolotherapy. After the first injection, he came back in 30 days. As I said, you wait till then. You say, what percentage better do you feel? It's like, oh, we're getting somewhere. My shoulder doesn't throb so much at night. This is good. We're definitely getting somewhere. I'm 60%. I was like, great. We're doing it again. We're not going to stop till we're at 100. Meanwhile, these are the 3 exercises I want you to do. So I put him on a couple home exercises, 2 rounds of Prolo. That shoulder was cured. He was just thrilled. And, able to then, perform and do what he wanted to do and needed to do on his job, and then on the hormonal side, got his energy back, got some of his mojo back, and was feeling a whole lot better.
Amazing. Can you share with us what on the hormonal side of things? Was it primarily TRT? Was there also DHEA, that $2 a month? What were you doing for that program?
So with him, it would have been TRT and DHEA. And TRT can take different forms, right? There's, of course, giving someone testosterone, but a lot of times I'm a fan of Clomid as well. I use that quite a lot because it preserves fertility in young people. So I think actually we use Clomid in his case to get his testosterone levels where we want. And then I started him on 50 milligrams of DHEA, which is typical, and that'll usually sort guys out nicely.
And Dr. Turner, I need to selfishly ask you, what are your favorite recovery tools or lifestyle habits to just enhance performance, longevity, recovery? Like, what should we be incorporating in our routines?
I'd say to pick one thing that will hit a lot of areas for you would be a sauna or infrared sauna.
Not the jumping in the cold sound, Puget Sound.
Yeah.
That's not for the faint of heart. And it could cause a heart attack if you're not careful, So sauna is the one regenerative therapy that's, I would say, amazing in terms of all that it can do. First of all, for cardiovascular system, Rhonda Patrick's talked a lot about this. I know you had one of your talks, right? She's published all this stuff.
Yeah.
It's amazing, right? Yeah. So I tell patients, it's kind of like doing cardio exercise in a box because your body doesn't know the difference between running outside on a really hot day and getting hot and sitting in this 180-degree sauna and getting hot. It just knows that it's hot. And when you're
cardio in a box,
it's cardio.
I love in a box. You need to sell that. You need to have your whole line of saunas.
There we go. I know. Connect me up with Rhonda. We'll start a line.
Love this.
It's like cardio in a box. We know it does things for blood pressure and, dilation of blood vessels and flow and all of that. So cardiovascular, amazing. Detox, amazing. Even mood changes mood, like neuroendocrine changes in the brain, dopamine, serotonin, endorphins, things like that. Amazing for that. It stretches you out. I like to stretch in the sauna. So before I work out, I don't just go work out, and I don't just stretch. I stretch in the sauna. So I'm like killing two birds with one stone, although I look a little weird in there, but whatever. And, it's great. So if you can just and it's great for recovery too, if you want to go right after you work out, either way. So if somebody can just start to love, 20 minutes in the sauna before or after their stint at the gym or at home, if they want to get a little home infrared sauna, that's the top thing I would say.
Speaking of at-home saunas, can you give us any insight into that? Because I know there's the ones where you can sit in and your head pops out, and I'm like honestly, I don't know how I feel about those. Do they get moldy? How do you clean them? What can we do if we're not jumping over to like a wellness or spa center or gym with a sauna? What do you like?
Yeah, I like one of those zip up infrared saunas, as you just described, with your head popping out. That's
if you can talk me into it. I mean, your stuff, so I'm open.
It's the thing. This is good. Yeah. So a couple of reasons I like that. You could get a wooden sit inside one that you put in the garage or something. But that tends to like probably sit in the garage, and you're not going to want to go out there. You're not going to see it so much. It's kind of out of sight, out of mind. Yeah. It's big, it's clunky, it's expensive. This thing, you can put it in your own bathroom. Okay. I put it in the guest bedroom bathroom. It's sitting right there. Yeah. And it's less expensive. I think it's maybe $1,400 or something, $1,200, something like that. You zip that thing up. I like the fact that my head's out. I think they mentioned that there's some kind of benefit to that. It's like not great to get your head hot or whatever, but I like it because your head's hot, so you can still do something. So I have my laptop open.
Oh, that's a good point.
And it's got a little zip out. You can take your hand out through this little zipper. So I can catch up on my basketball highlights on YouTube. I
wish we had a clip of you in your sauna right now.
It's just like this. And I got one hand coming out working my computer. So I'm starting my day, double duty there efficiently with that sauna, plus putzing around on my computer or read a book or whatever. So I'm a big fan. It cleans easily enough. My wife's a big hygienic, person, so I can understand that.
Yeah. Okay. You like it. I'll give it another thought.
Yes. And not to mention, it comes with a little grounding pad.
Oh, okay.
Yes.
Are you sitting on it, or is it on your feet?
You're putting your feet on it. Your feet on it. So it's the same thing as getting in 20, 30 minutes of grounding as well at the same time.
It's like all your therapies in one.
You are right there.
I think there's probably some competing brands out there. Can you mention your favorite?
My favorite brand is TheraSage. So THERASAGE, TheraSage. Okay. That's what I got. I'm super happy with it. I did my research. I actually talked to a nurse practitioner friend of mine who had one first. She said, I did all this research. I like this brand. And so I've been real happy with it.
Awesome. Thank you so much for sharing that.
Yeah.
Well, Dr. Turner, it's been a lovely hour with you. I feel like we could keep going on some of these topics forever. I love that we got to touch on PRP in depth because we haven't really done that on this podcast yet. Getting a little bit into men's hormones, all the different amazing therapies. I just want to thank you for your time, your expertise, and your thoughtful responses here. If anyone tuning in today wants to connect with you online or even potentially be a patient of yours, where can we find you?
Sure. So michaelturnermd.com is the best way. And I actually have a telemedicine practice in all 50 states. So though I reside in Washington, I see people California, Nevada, Hawaii, New York, it doesn't matter. Because I do telemedicine 4 days a week. And then I do my in-person sports rehab one afternoon a week for local people. So
awesome. Yeah. We'll link these down below for you guys so you can find Dr. Turner online. And until next week, wishing us all vibrant health and wellness. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. And just a reminder, this podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.